Welcome back, all of my dearest viewers. So, today's session I take a very small topic of forensic medicine, which is the suspended animation. Okay, so we try to understand what is the meaning of this suspended animation. So, this suspended animation is basically it is apparent death, also called as apparent death or death-like stage. So, what happened in case of the suspended animation? In case of suspended animation, the vital activities of the person get very reduced or almost negligible. So when the vital activities of a person get very reduced or almost negligible, in that condition there is the less oxygen demand for the all vital organs, and if person having a less oxygen demands, then it can survive in the less concentration of the oxygen. So these are the things happen in case of the suspended animation. In suspended animation, the person vitals activities get reduced or almost negligible. So when the vitals activity of a person get reduced or almost negligible, it is very difficult for the clinician to identify if a person is alive or dead by using normal clinical examination. So sometimes they declare death even a person in the suspended animation. So these are the things happen in case of the suspended animation. So now a time it is ensured that before declaring death of a person, it is re-ensured by taking the ECG. If ECG confirm that a person is dead, then the person is dead. It is basically two types. So one is the involuntary and another is voluntary. So voluntary means sometimes what happen in sadhu and yogi person, they having the control on your heart rate and the respiratory rate. They control his heart or breath rate by using yoga. So they gain the capacity to reduce his basal metabolic rate to at a minimum level. So when any person voluntarily reduce his vitals activities to the minimum levels, it is called voluntary suspended animation. But sometimes what happen in case of giving anesthesia, in case of drowning, in case of the newborn, this all condition the basal metabolics get reduced or negligible. These are the types of involuntary suspended animation. So what happens when person goes in suspended animation? What are the management? The first management is we go for the CPR. We also go for the cardiac massage and the artificial respiration. Is any medical legal importance of this suspended animation? Obviously, one of the most important the medical legal importance of a suspended animation is before declaring the death certificate, we must ensure the person is die or alive. Two more things. The one is the summer movement, the change in position of the body, George Washington case. So these all are the medical legal importance. So whatever I already discussed, these things are written on the boards. Suspended animation, also called the apparent death or the death-like stages. At this stage, the basal metabolic rate of a person is very low, or the tissue required the less oxygen demand. At result, the vital activities of a person is very minimum or the almost negligible when it is which is not detected by clinical examination and person appear to be dead. Okay, one more point. It is not for a higher duration like 1 hour, 2 hours. It is maximum for 0 to 30 seconds. Okay, duration is 0 to 30 seconds. Two types: voluntary by yogi and sadhu, and the involuntary after giving anesthesia, newborn after taking barbiturates, coma, and drawing. Management go for the CPR, cardiac massage, electrical stimulation, artificial respiration. Medical legal importance: rule out the suspended animation before declaring the death certificates. George Washington case. So this is all about suspended animation. Welcome back in new video.